Good afternoon and welcome. This webinar is a collaboration between the U.S. Department of Veteran Affairs, VA Center for Faith-Based and Neighborhood Partnerships, CFBNP, and the Veterans Health Administration, Office of Mental Health and Suicide Prevention, Education and Training Office. My name is Trulesta Pauling. I am the Senior Outreach Specialist in CFBNP. I will be a moderator this afternoon. Everyone's phone has been muted. If you have a question during the presentation today, please type it in the Q&A box on the right of your screen. I will read the questions at the end of the presentation, and the presenter will provide a response. This presentation is not available after this webinar, but a handout will be made available with all the resources Ms. Mells will speak about today. This is a live recording. I would like to thank Ms. Lillie Mells for this collaboration. We are grateful for your time today. But before we get started, I would like to introduce Mr. Conrad Washington, Director of the VA Center for Faith-Based and Neighborhood Partnership. Mr. Washington is a retired combat Marine with 20 years of active duty service. He is a licensed minister, actively serving in his faith. He received his Master's of Divinity in Pastoral Studies from Moody Theological Seminary. He has a master's degree in business management and a Bachelor of Science degree in education. Additionally, he is a graduate of VA's class of 2017 Virtual Expiring Leaders Program. Mr. Washington?
Thank you, True. I appreciate it. I want to thank all of you for joining us today. We appreciate you taking time as we're still in the virtual mode for many organizations. We know you have a lot of choices. I often refer to the buffet of virtual presentations. So we know that you had choices, but we thank you for taking time to share with us today and listen to our presentation from the VA Center for Faith-Based and Neighborhood Partnerships. I also want to acknowledge my great team that I have behind me, around me, and supporting and doing awesome things. In the background, I have Mr. William Morales, who's the unofficial IT. You heard from Ms. Trulesta Pauling, who does so many things for outreach. And I have Mr. Nicholas Walters, who's out doing some outreach right now. So I want to thank my team for doing great work and continuing to operate in excellence. This month is Black History Month. Black History Month is an annual celebration, as we know, of achievements by African Americans and a time for recognizing our central role in U.S. history. Also known as African American History Month, the event grew out of Negro History Week, the brainchild of noted historian Carter G. Woodson and other prominent African Americans. Since 1976, every U.S. president has officially designated the month of February as Black History Month. Other countries around the world, including Canada and the United Kingdom, they also devote a month to celebrating Black history. And obviously, I want to first kick it off by acknowledging Dr. Carter G. Woodson, who dedicated his life to educating African Americans about the achievements and contributions of our ancestors. He helped found the Association for the Study of Negro Life and History. Then about a year later, he single-handedly launched the Journal of Negro History, in which he and other researchers brought attention to the achievements of Black Americans, which led to where we are today. So we thank our great leaders from the history that contribute to where we are now. Tomorrow is Valentine's Day. That may mean something to many of you. So if you're celebrating, good for you. Don't forget it if you have responsibilities there. And I also want to take time to thank our great speaker, our colleague, a VA colleague of ours, Lillie Mells. She's great. She's awesome. She's been traveling with us for a couple of years now. We love you and we thank you for taking time, ma'am, for sharing your knowledge and expertise in this very sensitive topic. And I'm not going to steal your thunder because you have a wealth of knowledge, but I will share a couple of things about how important suicide prevention is. It is a national health crisis. It is preventable. You will hear Lillie tell us about that, but I want to reemphasize it. We know there's a 988 number. You press 1 for veterans. The White House has a national strategy for suicide prevention. That's how much of a priority it is. And so please know that if you're listening to me, Lillie, or anyone, it is preventable. We can assist. And it can be something as simple as speaking to people by saying good morning. But I'll leave it alone and let's get to it. So thank you all very much for joining us and be blessed.
Thank you, Mr. Washington. At this time, I would like to introduce Ms. Lillie Mells, who will be providing today's presentation. Please read a summary of her bio on the screen. Ms. Mells is a licensed clinical social worker with over 20 years of experience. She has worked in various capacities to include child abuse, domestic violence, and substance abuse. Lillie is an Air Force veteran and has served as Director of Psychological Health for the Virginia Air National Guard. She has been with the Department of Veteran Affairs since 2013, working in suicide prevention. Currently, she is the Education and Training Program Coordinator at the VA Office of Mental Health and Suicide Prevention. At this time, I give you Ms. Lillie Mells for today's presentation. Lillie? We can't hear you, Lillie.
Unfortunately, I'm talking on mute. I said thank you to Mr. Washington and thank you, Ms. Pauling and the rest of the CFBNP team. I'm excited to be here and ready to jump into this presentation. So before I start, I do want to ask a couple of questions. I always take a roll call to see who's in the audience. So I want to go ahead and start and see if we have any Army folks on the line. Please type in the chat box if we have any Army folks on the line. Okay. Any Navy folk? What about my brothers and sisters in the blue, Air Force? Any Marines? And then we got at least 2 in the house. Any Marines? Awesome, awesome. What about our Coast Guard? What about our Guard and Reserves? And last but not least, what about our Space Force, our newest member of the Armed Services? Okay, great, great, great. Well, I always like to take a pulse of who's in the audience because there's so many of us who have served and know someone who have served. And I, especially when I deployed, I served alongside each branch of the armed forces, and you just have a deeper respect for what each branch brings to the table. So I just wanted to be able to acknowledge that. So thank you all. And so now I'm going to go ahead and get started. I am going to shut my camera because sometimes I get some bandwidth issues, and then I'll come back on as we get to the Q&A part of the training. So before we begin, I'd like to at least state that suicide prevention can be a tough topic for most. However, if you're having any difficulties, you can take a break and step out. We won't go over any gory details, but sometimes just the subject alone will bring up a lot of emotions for people. So I do want you to be able to acknowledge that. If you need to call the National Suicide Prevention Lifeline, you can dial 988. It's also the same number as the Veterans Crisis Line, 988, and just press number 1 and you'll get contact. For veterans, press number 1 and you'll get contact with a Veterans Crisis Line person. 988, the National Suicide Prevention Lifeline, you'll just get in touch with a responder. So this is what we're going to cover today: facts about veteran suicide, common myths and realities about suicide, and the VA S.A.V.E steps. This is going to teach you how to act with confidence when you encounter someone who may be at risk for suicide. And then lastly, I'll cover some resources. So by participating in this training, you'll have a general understanding of the scope of veteran suicide within the U.S., how to identify a veteran who may be at risk for suicide, and know what to do when you do identify that person at risk for suicide. So my next question to you all is, what is your biggest questions and concerns in talking to someone in crisis around suicide? What are your biggest questions around suicide and talking to people in crisis? You can drop that in the chat box. And then hopefully by the time we get through this training, I would have answered that question for you. So now let's just go over some general facts about suicide. So as Mr. Washington said, suicide is a public health problem. It affects everyone. The numbers are growing nationally. We've seen increases in the rates of suicide among the general population as well as veterans. And so for every death by suicide, there's at least 135 individuals who are impacted. And one thing we know about suicide and suicide prevention is that the VA can't do it alone. We need a community approach in solving this problem. Now, suicide is a complex issue with no single cause. If we knew the single cause, we could definitely drill down those numbers. It's often a result of a complex interaction of risks and protective factors at the individual, community, and societal levels. So when we talk about risk factors, these are those things, those challenges, those things associated with increased likelihood of suicidal behaviors. Protective factors, these are buffers, these are tools, these are skills that can offset risk factors. And to prevent suicide, we must maximize the protective factors while minimizing the risk factors at all levels throughout communities nationwide. So remember, maximize the protective factors, minimize the risk factors. Now let's go over some of the risk factors and protective factors that I mentioned. One of the things to say about this is that this is not an all-inclusive list. There are many more things that we can add to this list, but for time's sake, we only added these. But like I said, there are many more that we can add. So let's start with the risk factors. Remember what I said those are. These are challenges. These are things that behaviors that can cause people to become at risk for suicide. First, prior suicide attempt. Doesn't mean that everyone who's had a suicide attempt will go on and have another attempt. However, once you've had an attempt, it puts you at greater risk for suicide than someone who has not engaged in that behavior. Next, mental health issues. And when we talk about mental health issues, we're talking about those untreated issues. We're talking about depression, anxiety, bipolar disorder, schizophrenia, all of these mental health disorders that complicate things. And if they go untreated, you can be at risk for suicide. Next on the list, substance abuse. Anytime you engage in using mood-altering substances, it puts you at risk for suicide. Your judgment is off, what you think about is off, and just your whole being is off. And so we want to make sure that when folks are engaged in substance abuse, that they get the correct treatment, because many times it really leads to putting themselves at risk. Next, access to lethal means. Now, this is a big one. When you have access to lethal means, it definitely puts you at a risk for suicide, especially if you're dealing with some of those other issues, mental health issues, substance abuse, and having access to lethal means. One of the things we know about lethal means is that lethal means could mean firearms, it could mean medications, it can mean a variety of things. But what we have found is that in this country, and especially among veterans, firearms is the #1 means that folks are using in terms of suicide. And so we want to make sure that we educate not only the veterans, their providers, and their family members, but when you have access to lethal means, it puts you at a greater risk for suicide. Next, recent loss. So when we talk about loss, this could be loss of limb, loss of life, loss of a loved one. It's a variety of things. But when someone has experienced loss, it definitely puts them at a greater risk for suicide. Next, legal or financial issues. So when someone is facing legal issues, especially when we're talking about possibility of going to jail, it definitely puts them at risk for suicide. And along with that, financial challenges, bankruptcy, taxes, things like that. It definitely puts you at a greater risk for suicide. Next, relationship issues. Relationship issues are big on this list because when we have failed relationships, many times it can feel as if you're going through the grieving process. And when someone goes through the grieving process, it's almost as if they're going through a relationship breakup. And they'll experience some of the same issues that many experience when they're going through the grieving process. Shame, it could be guilt, it could be anger. Many of these issues one would experience. Next on the list is unemployment. So when someone is unemployed, they're definitely going to experience a lot of issues in terms of being able to support themselves, their family. And when you're unable to support your family, it definitely puts you at a risk for suicide. Definitely puts you at a risk. Last but not least on the list is homelessness. So when someone's facing homelessness, it definitely puts them at a risk for suicide. not having a place to live, not having a place to shelter for yourself or your family, it definitely puts you at risk for suicide. Next, let's look at the protective factors. So the protective factors are the buffers, the skills, the things that you can use to avoid the behaviors of suicide. So when we talk about those factors, access to healthcare. So when you have access to healthcare, it definitely puts you in a better position than someone who doesn't have access to healthcare, mental health care. And when we talk about access to mental health care, we want to be able to make sure that we're being treated for those ailments. So we have many people who are walking around with untreated mental health issues. And when you have untreated mental health issues, it definitely puts you at a risk for suicide. There are some issues that you must receive treatment for. And there's just no question about it. If you're suffering from bipolar disorder, schizophrenia, those type of issues, you need to have ongoing treatment for them. Okay? Next on the list is sense of connectiveness. And a lot of our military folks, when we're serving in the military and we're behind those gates, there's a sense of connectedness and camaraderie that you have when you're serving behind those gates. And for many people, when they leave the military, it's gone. You know, they don't have that same sense of camaraderie that you would have behind those gates. And remember, while you're in the military, it's like living in a community within a community. Everything that you need is there. And when you're serving with your unit, your team, you know exactly what your mission is. So having that sense of connectiveness is definitely a protective factor. Next, problem-solving skills. Now, I will tell you this. Many of us did not learn problem-solving skills. If we learned problem-solving skills, we probably would do much better as adults than we did as children. Okay? Now, I grew up in New York City. And in New York City, it's tough growing up. I grew up pretty much in the 80s. And as a child, you know, we only knew one type of problem-solving skills. Okay, can anybody drop that in the chat if you think you know what kind of problem-solving skills we had growing up in an urban city? Let me see what you guys are putting in the box. There was only one kind, exactly. I think somebody hit it right on the head. Violence and fighting. Yeah, and that's the way some people learn how to problem solve. But I will tell you, it's not a good use of skills. It's not something that you can do your entire life. It's just not a good way to problem solve. And so once you learn how to truly problem solve, then you can navigate through crisis situations and stressful situations much better. Okay. Next on the list, we have sense of spirituality. And I will tell you, sense of spirituality is very individualized. You know, some people will practice formal religions. Some people will go to a church or a mosque. Some people will meditate. Some people will read their Bible. It just depends on what works for you. Okay. Next on the list is mission or purpose. So one of the things about serving in the military is that you definitely have a mission and purpose while you're serving. You know exactly what your job is and what you're supposed to do. And even when you deploy, there's a certain amount of people for certain positions, and you know exactly what you're supposed to do. A lot of times when folks leave the military, whether they retire or separate, you kind of lose that focus. You lose that mission or purpose. And sometimes we just need to make sure that we still have that mission or purpose going on in our lives. So yes, it's very important. Next, physical health. One of the things I will say about physical health is that, you know, when I was serving in the military, I had no pain. Got up and was at the office every day, 7 o'clock, 7:15 in the morning. And sometimes didn't leave till 6 p.m., 7 p.m., depending on what was going on. But never had any pain, did the PT, did all of that stuff. And then when it was time to retire, I had more pain than I ever knew. And it's because when you're serving, you tend to ignore things, you tend to neglect yourself, neglect your body. And we really don't need to do that. And so what I would say is that if you have ailments or illnesses that you've been putting off and have not sought attention for, you really need to get help for those things, because there's no reason to walk around in physical pain every single day. And for people who are doing that, it does put them at risk. Just imagine walking around in pain every single day. It definitely puts them at risk. But when you're being treated for these ailments and injuries, it definitely is a protective factor and puts you in a better position than someone who's not being treated for those. Next, employment. So when you're gainfully employed, it definitely is a protective factor. When you're gainfully employed, it means not only can you take care of yourself financially, but you can also take care of your family. And that's definitely a positive protective factor. Next, social and emotional well-being. So you definitely want to be in a position where you're involved in things that elevate you and elevate your community, and also taking care of yourself. So when you're able to do those type of things, it definitely puts you in a better position than those who are not engaged in emotionally and social things that are positive in their lives. Next, I'm going to go over some of the key findings of the 2022 National Veteran Suicide Prevention Annual Report. I will tell you our latest report is out. We just have not been able to update the information, but it's still useful information that you can take something from it. But the latest report and data will be coming out in terms of our briefings, so that will be coming soon. So if we look at veteran suicides and deaths from 2001 to 2020, we saw that there was a slight dip in deaths, about 399 between 2019 and 2020. The thing about this number, I will tell you, is that it's not a huge number. It's not something that we can really, really celebrate. And so I don't focus on this too much. I focus on the fact that we need to do more. So it was a slight dip, but not really anything that we can celebrate. Now, if we look at veteran suicide rates by sex and age, and we'll see that 18 to 34-year-olds are still leading the pack. The next group is 35 to 54. Next group, 55 to 74. But look at this number of our 75-year-olds and older. Their numbers are starting to increase. Okay. Veteran men are still leading the suicide rates, along with veteran women. Okay. Now, earlier I talked about lethal methods of suicide. And so here, look at some of the lethal methods that are being used: firearms, poisoning, suffocation, and other. And other can be a variety of things. It's just that the numbers were too small to actually make the chart. So we had to lump them together as others. But if you look at non-veteran adults in 2020, the use of firearms, over 50%. Okay? Go to the next column where you look at veteran adults, 71%. Okay, so veterans are already higher than our civilian counterparts. Now, when we break it down to men and women, so look at the non-veteran men, 55%. Look at the veteran men, over 72% are using firearms. Next column, non-veteran women, 33%. Look at the veteran women, 48%, over 48%. So what that told us is that we had to do more in terms of educating our veterans, our family members, and our providers on lethal means and lethal means safety. We know that firearms is the #1 method that's being used. One of the things that the VA has done is foot stomped its education, making sure that the providers understand how to talk to their veterans about firearm and firearm safety. Make sure that veterans and family members are able to discuss safely storing firearms, especially when they have children in the home. Next on the list is poisoning and suffocation. None of those, none of those come even close to firearms, as you can see there. None of those categories come close. So the VA has had to educate, like I said, more so the veterans, the providers, and their family members. And we had to educate on lethal means safety. So in the context of suicide prevention, Lethal means safety is safe storage of lethal means is any action that builds in time and space between a suicidal impulse and the ability to harm oneself. So again, the ability to build in time and space between when a suicidal impulse occurs and ability to harm oneself. And effective lethal means safety education and counseling is collaborative and veteran-centered. So one of the things that we have done at the VA is, let's say a few years ago, if someone was suicidal and we knew that they owned a firearm, the first thing that we would do is contact the authorities, have the firearm confiscated, and they would never get that firearm back ever again. What we found with that is that then people began to realize that, oh, I'm not going to get my firearm back. Then they stopped being honest about having the weapon. And we knew that that wasn't working, because if people weren't going to be honest about having the weapon, there was no way to know what was in the home or whether we could help them safely secure it. So what we had to do is re-educate and say, okay, we understand that you have a weapon. You're going through this crisis. Can we get you to safely store and secure that weapon? Lockbox, cable gun lock, give that key to a trusted friend or relative until you can get through the crisis. And what we found is that that seemed to work better than just confiscating the weapon entirely. The other thing that we did was, like I said earlier, is that we educated our providers. Some of our providers have never touched a weapon. Having them understand what owning a weapon means to some people, understanding the use of a firearm, those type of things, and then educating the member along with their family. And what we found is that that seemed to work a lot better than just confiscating the weapon entirely with no other explanation. So most suicidal crises are brief. The time from decision to action is usually less than 1 hour. And so here are some studies here: less than 5 minutes, 24%, less than 20 minutes, 48%, and within an hour, 71%. And when we look at the fatalities, so from using a firearm and firearm injury, 85 to 90% fatality. All other methods combined, less than 5% or 5% fatality. So it tells you that most people can survive using other methods. However, firearm is the #1 method, and the fatalities numbers don't lie. Okay, and lethal means safety, it does work. So reducing access to lethal suicide methods is one of the few population level interventions that has been shown to decrease suicide rates. And about 90% of people who survive suicide attempt do not go on to die by suicide. So that's a good thing. And so what we have done is we've collaborated with veterans ahead of time and helped them survive the suicidal crisis. And when we've done that, we've likely prevented suicide for the rest of their lives. Now, I want you guys to get ready. I'm going to start to ask some more questions. And so I want you to get ready to type in the chat box or the Q&A box. So let's start. These questions are going to be answered with either myth or reality. So either you type myth in the box or you type reality. People who talk about suicide are just seeking attention. Is that a myth or reality? People who talk about suicide are just seeking attention. Is that a myth or reality? So let me see what I'm getting in the box. Okay, I have a lot of myths, a lot of myths there. Okay, you guys are doing good. It is a myth, because no matter how casually or jokingly said, suicide threats should never be ignored, and they may indicate serious suicidal feelings. So someone who talks about suicide, it provides you an opportunity to intervene before those behaviors occur. And so let's say someone is talking about suicide. They may not necessarily have a plan or intent to harm themselves. However, when they're talking about suicide, they're letting you know that they are feeling overwhelmed and they've got these things going on. And you definitely want to take those things seriously and try and get them help immediately. Okay, next question. Myth or reality? The only one who can really help someone who's suicidal is a mental health counselor or therapist. Type in your answer in the box. The only one who can really help someone who is suicidal is a mental health counselor or therapist. Okay, I'm seeing some answers in the box. Great. So you guys are doing good. So it is a myth. Special training is not required to safely raise the subject of suicide. So helping someone feel included and showing genuine heartfelt support can also make a big difference during a challenging time. Okay? And so just being a good friend, a good listener, allowing that person to vent and share their concerns, you've gone a long way. You've gone a long way, and you don't have to be especially trained to do that. Okay, now I'm going to cover the steps to VA SAVE. And as I mentioned earlier, this is our gatekeeper training. This is our entry-level training for suicide prevention. And what it's going to do is going to help you act with care and compassion if you encounter someone in a suicidal crisis. S, the signs of suicidal thinking should be recognized. A, ask the most important question of all. So I'm going to pause here and I'm going to ask you all, what's the most important question of all that you should be asking if someone is in a suicidal crisis? What is that most important question of all? Okay, I'm looking to see what you guys put in the box. And so I'm not going to answer that question just yet. I'm going to leave you hanging just a little bit. V, validate that person's experience. E, encourage treatment and expedite getting help. So let's start with S, signs of suicidal thinking. So this is what you want to do. You want to learn how to recognize these warning signs. Hopelessness. You're going to see a lot of that, especially from our veteran population, dealing with their own personal issues, separating from service, whether it's retirement or just separation, feeling like there's no way out of their situation, okay? Anxiety. Anybody know what anxiety is? That feeling of nervousness, something is about to happen, you're not sure who, you're not sure when, you're not sure why. Some people have different symptoms when it comes to anxiety. Some people have sweaty palms, some people will feel nervous, some people will have a churning sensation in their stomach, some people will be nauseated, some people will have a racing heart rate, some people will go into a full-blown panic attack, okay? But these are serious signs of suicidal thinking. Agitation, sleeplessness or mood swings, feeling like there's no reason to live. Then there's rage and anger. And one of the things that we know about rage and anger is that it's usually a mask for other issues, usually a mask for mental health issues. When you pull back the layers of rage and anger, you'll probably find some depression. You'll probably find some anxiety. You may even find post-traumatic stress disorder. But usually that rage and anger is a mask for other things. And the other thing we know about rage and anger, especially when it comes to men and women, a lot of it is a learned behavior. Men are taught that you don't show these kind of emotions to cry and things like that. And the easiest thing for them to do is show the rage and anger and revenge-seeking behavior. Okay. Next, engaging in risky activities without thinking. And you may have seen some of that around you where people are engaged in risky activities. This could be riding a motorcycle at high rates of speed, weaving in and out of traffic, no helmet, things like that. We have seen that, okay? Increasing alcohol or drug use. And remember what I said earlier, anytime you engage in mood-altering substances, it affects your judgment. And when your judgment is off, it puts you at risk for suicide, okay? Withdrawing from family and friends. And now the presence of any of the following signs require immediate attention. So thinking about hurting or killing themselves. Looking for ways to die. And believe me, there's 1,000,001 things that you can do to the 10th power, okay? Talking about death, dying, or suicide. Self-destructive or risk-taking behavior, especially when it involves alcohol, drugs, or weapons, okay? Especially when it involves alcohol, drugs, or weapons. Now, A, asking the question. Know how to ask the most important question of all. So I'm going to check that box again. Any last minute answers? What is that most important question of all? I think I saw 1 or 2 correct answers in the box. Okay, so the most important question of all is, are you thinking about killing yourself? There you go. I see somebody has it in the box. Are you thinking about killing yourself? And the reason this is the most important question that you want to ask, because you want to make sure that you know what this person is going through and what their intentions are. You don't want to say harming or hurt, because harming and hurt can mean different things to different people. So if I say to you, are you thinking about killing yourself? There's only one meaning to that. Are you thinking about killing yourself? But if I say, are you thinking about hurting yourself? Well, hurt could mean a lot of things. It could mean burning yourself with a cigarette. It could mean a variety of things. So we want to make sure that we're clear, and we want to make sure that we're going to get an honest answer when we ask this question that way. Now, there are things that you want to consider when you're asking that question. You don't want to ask the question if you do want to ask the question if you have identified the warning signs. So if you identified those warning signs, you want to go ahead and ask that question. Ask the question in a natural way that it flows with the conversation. So when you're talking to someone and they're down and they're saying these things, you want to ask it because it's flowing in that conversation. Okay? Don't ask the question if you're looking for no answer. So if I'm looking for a no answer, I'm going to put no in my question. So how do you put no in the question? So if there's someone who I suspect is suicidal, if I say, you aren't thinking of killing yourself, well, that's really telling them that they're not going to kill themselves instead of allowing them to answer the question themselves. Okay? Another example would be of, and I think my colleagues on the line have heard this before, sometimes when I'm talking to my daughter and she likes to wear these Crocs, these shoes, I don't like them, Crocs. I feel like those shoes should not be worn out in public. They belong on the beach, but that's my personal opinion. However, my daughter, every opportunity she gets, she wants to put these shoes on. And so if I don't want her to wear those shoes, this is what I would say to her. Nicole, you're not wearing those shoes, are you? If I say, Nicole, you're not, I've already told her she's not wearing those shoes. She can't give me an honest answer because I've already told her no. So it's the same thing. You aren't thinking of killing yourself, are you? You've already told them they're not. So they're not going to be forthcoming with you. Now, if I wanted a straight answer from her, then what I would say is, Nicole, what shoes are you wearing today? And then that would give her the opportunity to pick whatever shoes she wants. So if I say to you, are you thinking of killing yourself? That gives them the opportunity to tell you, yes, I'm thinking about that. Okay? But you don't want to put the answers in their mouth. You want them to give you the answer. Don't wait to ask the question when someone is halfway out the door. If you wait until they're halfway out the door, guess what? They're going to dump on you. And if you got somewhere to go and there's only 2 minutes left, you're not going to have that opportunity. So you want to make sure you ask it early enough so that you can intervene and get them the help that they need. V, validate that person's experience. I will tell you, when you validate someone, you have gone a mile and a half. Because when you validate people, you make them feel that they're important, that their opinion matters, what they say matters. Okay? And so when you talk openly with a person who's suicidal, you're giving them the opportunity to express what's going on. You want to be willing to listen and allow them to express their feelings. You want to recognize that the situation is serious and you don't want to pass judgment. One of the things we know about human nature is that we could pick up very easily when someone is passing judgment on us. Okay? So you don't want to pass judgment. You want to reassure them that help is available because help is available. But I will tell you, when you validate them, you just make them feel important. Think about this growing up as a child. I remember the first time I was pretty much told to shut up. Now, that's being a little harsh right now, but in essence, I was pretty much told to be shut up maybe around 5 or 6 years old, because children should be seen and not heard. So you should sit down and be quiet. And it doesn't matter what you have to say, sit down and be quiet. So imagine someone growing up encountering this response, be quiet. They get a little bit older. Maybe they join the military, 18, 19 years old. What's the next thing that happens? Be quiet. Shut up and color. I'm the boss. You be quiet. Those kinds of things. So you can imagine, okay? And then let's say they go into the workforce. You're not the supervisor. You're not the boss. Shut up again. Many times people just want to be heard. They want to be able to vent. They want to be able to express their opinion. They want to be able to say what's on their mind. And if you're a good listener and allow that, you've gone a long way. Next, E, encourage treatment and expedite getting help. So what should you do if you think someone is in a suicidal crisis? Don't leave that person alone. Don't keep that suicidal behavior a secret. This is not a secret we want to keep, okay? Don't leave them alone. I don't care if the room is empty and you think that nothing's in there, do not leave them alone. I'm telling you, we have seen things where we thought, oh, the room is empty. There's always something in there, always something. So you want to make sure that you stay with that person. Try to get that person to seek immediate help from his own doctor or the nearest hospital emergency room. Call 911. Reassure the person that help is available. If it's a military veteran service member, call 988, the Veterans Crisis Line, and then press number 1. When talking with a person at risk for suicide, the first thing you want to do is remain calm. Don't get all excited. It's not going to help the situation. Remain calm. Listen more than you speak. Remember what I said. Validate that person. Allow them to vent. Listen more than you speak. Maintain good eye contact. Act with confidence. We may not know everything to do, but you want to act with confidence, okay? Don't argue with that individual. Stay away from all those controversial topics. Religion, politics, abortion. Stay away from all those topics. It's just going to be a dead end. Everyone has their heels dug in. Nobody's budging. So stay away from those topics. Use open body language. Don't be like Macaulay Culkin on Home Alone with the shocked face. Use open body language. Limit your questions. Let that individual do the talking. Use supportive, encouraging comments. That's going to be very helpful. Be honest. Let them know that there's no quick solution, but help is available, because help is available. But there's no quick solution. You know, we've had cases where someone has said, I'm 8 months behind in my mortgage, I'm going to kill myself. But we have to be honest at the VA. The VA is not going to pay 8 months of your mortgage and write a check for this. It's not going to happen. However, there are other programs that can assist. And if you're 8 months behind your mortgage, it's going to take at least 8 months to clean it up. Okay? So we try to be as honest as possible and offer other solutions and resources. So what do you do if someone expresses suicidal ideation during a phone call? You want to keep that caller on the line. Don't hang up or transfer. And I will tell you, even when I was in the office full time, I was never really good at transferring calls. I just didn't get enough calls during the year to be good at transferring. And so this is not the time where you want to figure out how to transfer a call. Keep that person on the line. Remain calm. Identify as much information on that caller that you can. Their name, their phone number, their current location, whatever you can get. Nickname, doesn't matter. Just get as much information as you can. If you are savvy at conference call, there is a way to conference call to the Veterans Crisis Line. But generally, we leave those for our switchboard operators and our call center operators, unless you really know how to do it. And you don't want to hang up until the responder from the crisis line has the call. If you work in the office, enlist your coworkers for assistance via instant messaging, Teams, whatever you have to do. Get someone to help you while you have this person on the line. Many of us who work for the government, we have our personal cell phones and we have our government cell phones. So if you have to call someone and say, hey, this is going on, then you want to be able to, get some assistance. And with Microsoft Teams, for those of you who work in offices and you have Microsoft Teams, you can contact anybody on Microsoft Teams and just message them, hey, I'm on a call with so-and-so, I need your help and some assistance. So be able to do that. If you're on the line with the caller and they disconnect, call back immediately. If no answer, then you want to go ahead and call 911 and ask for a welfare check. Let them know that you had concerns, you were on the line with this individual and you got disconnected. Once you're done with 911, then you want to go ahead and call 988, which is the Veterans Crisis Line, and they'll pick up from there. And those were our basic steps of suicide prevention, our S.A.V.E. training. Signs of suicidal thinking should be recognized. Ask the most important question of all. That question is, are you thinking of killing yourself? Validate that person's experience, encourage treatment, and expedite getting help. And now I'm going to cover some of our resources really quick, and then we'll get to some questions if we have time. So our Veterans Crisis Line, it operates 24 hours a day, 7 days a week, 365 days a year. Your call is confidential when you call. Anyone can call this number, veterans, active duty folks, family members, friends, or you can even call anonymous. In 2022, this number went from a 10-digit number to 988. So it operates sort of like 911, except it's for crisis, mental health crisis. And so you can dial 988. And that's also the same number for the National Suicide Prevention Lifeline. The only difference is that if you press 1, that would be the Veterans Crisis Line, and you'll get a veteran responder. The crisis line opened up in 2007 and has been going strong since. You can see the numbers there. We've had over 6 million calls, over 800,000 chats, over 299,000 texts, over 1 million referrals, and over 269,000 dispatches of emergency services. And when we talk about dispatches of emergency services, that's actually emergency services going out to the location where the individual is. Referrals, if someone calls the crisis line and they say, you know, I'm in a crisis, I'm going to kill myself right now, emergency dispatch will be sent out right away. If they say, you know, I'm having these thoughts, but I don't want to hurt myself, then the responder will safety plan with that individual, and then a consult will be sent to a suicide prevention coordinator at the Veterans Hospital, and they have 24 hours to contact that individual. And the VA has suicide prevention coordinators, over 400 of them located nationwide. There's one at least every medical center, and in some cases there may be more. They also have a team that work with them, case managers, who follow up as well. And this is our veteranscrisisline.net resource locator. So if you go to this website, you can locate any VA medical center, you can locate our community outpatient clinics, you can locate the vet centers, and you can locate the suicide prevention coordinator in your area. Making the Connection, this is a series of vignettes where you have real veterans talking about their struggles with mental health and getting help by going into mental health and the VA and getting help. So these are some really good vignettes, and these are true stories of real veterans giving their testimony. Next, practice safe storage of firearms, medications, and other lethal means. Keep it safe. KeepItSecure.net. So we have used this. There's a lot of information on here on securing firearms and other lethal means. New lethal means safety resources. I remember before I told you about educating not only the provider, the veteran, as well as the family members. Then we have some mental health apps, mobile apps. These apps, they can be used. I recommend that they be used in conjunction with your therapist. They're not meant to be a sole source of mental health, but they can be used in conjunction with your therapist. PTSD Coach, it has our safety plan in there. And now the safety plan can be on the mobile app. And a safety plan is basically 6 steps, written list of things that you can do when in a crisis. And there's 6 steps to the safety plan, and you click on each step and you give, so one of the steps may be, where can you go? And you will list the places that you can go for safety. Who can you call? Where's your nearest hospital? Those types of things. And so it's just good if you have that on your phone and you can pull it up anytime in a crisis. Coaching into care. This is good for family members who have a veteran who may need some help but is reluctant to come in for care. So if you go into coaching for care, they can assist with getting help. And they may even talk to the veteran themselves. We have resources for LGBTQ. This is not new to the VA. We've been serving LGBTQ veterans, and so now we just are making sure that there are more resources available. Postvention resources, we don't talk about postvention a lot. However, you know, it is something that we need to be cognizant of in our society. And so this is for providers and companies and organizations to be aware of and just be ready to serve our community and workplace when these things do happen. Psych Armor, this is one of our partners in education and training. They develop videos for us. They have the S.A.V.E training on video. It's about 25 minutes. You can go on their website, do the training for free. All you have to do is just register. And then they have some other trainings on there too that you can take a look at. And I think that's all I have. And I'm going to turn it back over to Ms. Pollock.
Thank you so much, Lillie. Appreciate that. Very informative presentation as always. Now we're going to address questions in the Q&A box on your screen here that I see. This is going to provide a response. If we are unable to get around to your questions today, we will take them down your questions and she will get a response back to you directly. We do have your email address, and let's go ahead and get started with the first question from Shannon. And her question is will bringing it up increase risk of self-harm?
Okay, so if you're talking about bringing up the subject of suicide, absolutely not. If someone is having suicidal thoughts, you cannot plant that in their head. That's there. So bringing it up or approaching the subject will allow them to express what's going on and allow you an opportunity to help them. So no, it does not.
Thank you so much, Ms. Mel. Second question from Richard Reck. How do you identify a person who is having issues? It is my understanding that it is not always planned.
That is correct. That is correct. I mean, you know, one of the things about human nature is that we're the masters of disguise, and especially those who have served in the military. We're a master of disguise. We put on that smiley face every single day. And you just have to pay attention to what's going on with that individual, what's going on in their life, what's different about what they're doing today than they did yesterday. And, you know, many times when we do what we call a review of that death, we find that people did see things and they just didn't put it together. So sometimes you just have to pay close attention to what's different and what's going on in that individual.
Thank you so much, Mr. Reck, for that question. Next question is from Berthenia Ogden. Uncertainties regarding the many triggers. How do you minimize voicing triggers when you really do not know what triggers the person may have?
Yeah, that would be very difficult because, you know, triggers, it can encompass a lot of things. We're talking about triggers for suicide, triggers for mental health issues. Usually, if someone is having triggers, there's usually underlying issues beneath that. You know, it's usually some other underlying issues that are going on.
Thank you so much. And she goes on to ask another question. If you are face to face with someone that you know has access to a weapon and you contact the authorities, how do you rebuild that trust with this person moving forward? It seems like they might see this as a betrayal of their trust in you, even though it was done for their benefit.
Well, I think early on, if you know anybody who has weapons in their home, you should always encourage them to lock them up. Even when they're not in a crisis, those weapons should be locked and they should be secured. So I think that's the first step, you know, building that rapport that, you know, we got to make sure that these weapons are locked up. Anybody could handle a weapon in your home, children, grandchildren, and many times, especially children, they're watching everything that we do. And we may say, oh, they can't reach that weapon on top of the toppest counter, but guess what? They find a way. So I would start out by encouraging that individual to have that weapon safely secured and ask the question, if you were in a crisis, you know, how would you secure your weapon so that, you don't, engage in using it? So you definitely want to be able to do those things and do it early enough.
Thank you so much, Ms. Mells. We do have additional questions, and we're going to get those questions to Ms. Mells for you to answer. At this time, I'm going to turn the mic over to Mr. Washington for closing remarks.
Thank you, True. Lillie, we appreciate you. Thank you for taking time. I know you're busy with a lot of things going on in the VA. Great information. I really like your response to locking up weapons. That's such a huge thing. But again, thank you, man. We appreciate you. And all of you joining us today, we appreciate you. We're going to be in Kentucky on February the 24th. Go to our website to get the address. We look forward to seeing you. And you all stay safe and be blessed.
Thank you.
If you registered for this event, we will provide you with today's resources. A recording of this webinar will be provided on our website at a later date. Please subscribe to our website and Facebook for future webinars and sharing our information. This adjourns today's webinar. Remember, we will get back to you all that had questions and we weren't able to get around to you today. Thank you so much for joining us today. Stay safe and goodbye.